Welcome back. Here is a challenging microbiology case for you. Watch closely, think critically and see if you can identify the cause before the answer is revealed. Pay attention to the clinical signs and the details of the virus. They hold the clues. Can you solve this case? A swine farm is experiencing a sudden and devastating outbreak. Pigs of all ages are affected and the animals are presented with high fever, loss of appetite and sudden death. But there is more. Some pigs shows a striking clinical signs, that is cyanosis of the ear, often described as blue ear. Others are struggling to breathe, showing clear signs of respiratory distress, and the pregnant sows are aborting. What kind of pathogen could cause this combination of systemic, respiratory and reproductive signs? And another clue is that the disease spreading rapidly through the herd with nearly 100% morbidity and high mortality. On necropsy, the findings are severe. The lymph nodes are enlarged and hemorrhagic. The spleen is markedly enlarged and the lung shows pulmonary edema. So this is not a localized disease. This is a systemic, highly destructive process. And the laboratory analysis identifies a large envelope double-stranded DNA viruses. Interestingly, unlike most DNA viruses, this one replicates in the cytoplasm of the infected cells, specifically targeting macrophages. A DNA virus replicating in the cytoplasm and infecting macrophages? Yeah, this is a critical hint. Which of the following is the most likely etiological agent? Let's narrow it down. The classical swine fever virus is an RNA virus and does not match the DNA profile described. So we can cut this one. Porcine reproductive and respiratory syndrome virus primarily cause reproductive and respiratory disease, but typically with low mortality and without any severe hemorrhagic lesion, and it is a RNA virus. So we can cut this one also. The swine influenza virus is also a RNA virus, mainly affect the respiratory system without causing widespread hemorrhages. So this is also out. So we are left with only one key suspect, a highly virulent virus that infect macrophages, cause massive cytokine release, damages blood vessels and lead to widespread hemorrhage and organ failure. The answer is African swine fever virus. This virus belongs to the Asfaviridae family and is one of the few DNA viruses that replicate in the cytoplasm. Its ability to destroy macrophages and trigger an overwhelming inflammatory response lead to a severe clinical and pathological finding seen in this case. When you see a rapidly spreading, highly fatal disease in pigs with hemorrhagic lesions and a cytoplasmic replicating DNA virus, always think of African swine fever virus. Did you get it right? Thanks for watching.